Hi viewers. Today we learn a little bit about Cushing's disease. What is Cushing's disease? Little bit we learn about the history of how Cushing's disease was first described. Then we'll also talk about how to go about recognizing whether someone has Cushing's disease or not, how to confirm the diagnosis, and how to go about localizing the problem in Cushing's disease. Okay. So, Cushing's disease is different from Cushing's syndrome. Cushing's syndrome refers to a set of symptoms and signs which indicate that somebody is having a excess cortisol in the body, and Cushing's disease refers to the particular cause of Cushing's syndrome, which is due to a tumor in the pituitary gland. This is very important to note the difference between the two. Cushing's syndrome is extremely common. Cushing's syndrome is most often seen due to exogenous steroid intake. For example, someone has an autoimmune disease and we are offering steroid therapy in order to suppress the immune system. This is the most common cause for Cushing's syndrome, and it is very ubiquitous. I think almost 1% of the population may at various points require a oral steroid therapy in their lifetime, and when it is given beyond a particular duration, say maybe more than 1 or 2 weeks, you start noticing features of Cushing's syndrome. It's extremely a common entity. But Cushing's disease, on the contrary, is a very rare condition which occurs due to a small tumor in the pituitary gland. The tumor may be small or large, that's different, but it's due to a tumor in the pituitary gland which produces a hormone called ACTH, and this ACTH producing tumor stimulates the adrenal gland and makes it produce more cortisol, and this cortisol in turn produces features of cortisol excess, which is Cushing's syndrome. So all Cushing's disease will have Cushing's syndrome, but all Cushing's syndrome is not Cushing's disease. It's a crucial difference between these two entities. So classically, Cushing's disease is considered an endogenous Cushing's syndrome. So to differentiate from the very common garden Cushing's syndrome, which is due to exogenous steroids basically. So little bit about the history of Cushing's disease. So Cushing's disease is actually described for the first time by Harvey Cushing, who was a neurosurgeon. So the neurosurgeon described a syndrome wherein patients were gaining a lot of central obesity. They had a abnormal central obesity. They were losing muscle mass, and they developed a lot of stretch marks. And these individuals also had a tumor in the pituitary gland. And when the tumor was removed from the pituitary gland, so the features of Cushing's started improving in these patients. It's a landmark discovery, and these patients got a second lease of life due to the surgical intervention of the neurosurgeon called Harvey Cushing. So later on, cortisol was found to be the cause of this disease, and the cortisol was being produced due to an excess of ACTH, which was being produced in the pituitary gland. These are the early days of endocrinology, where we are trying to learn about various hormones, how they change our body. But having said that, Cushing's disease is a very, very rare entity. 1 in a million people will be having Cushing's disease in a year in any population, any given population. So for example, if you take the whole of Bengaluru, which has a population of about 10 million people, about 10 patients with Cushing's disease will be diagnosed in Bengaluru city or larger Bengaluru area over a period of a year's duration. So this is a very small number, and probably we endocrinologists will not see Cushing's disease as commonly as we probably need to. So there's a lot of discussion, and we also learn a lot new about Cushing's disease as the days progress, as the years progress, and I do have experience of dealing with more than 10 or 15 patients with Cushing's disease over my relatively long career. So when it comes to Cushing's disease, first we need to make a diagnosis of something called the endogenous Cushing's syndrome. So Cushing's syndrome is a condition, as you all know, of cortisol excess. We need to prove first of all that the cortisol is actually coming from your own body and not from outside. So in order to do this, we do something called a 1 milligram dexamethasone suppression test. It's a very simple test. You take 1 milligram of dexamethasone. Next day morning, you check the cortisol value. And the next day morning cortisol value should come less than 1.8 microgram per deciliter. So this is the cutoff which we use to diagnose Cushing's syndrome or an endogenous Cushing's syndrome. So once you are diagnosed endogenous Cushing's syndrome, the endogenous Cushing cortisol can come from two sources. One is it could be due to ACTH, which is produced in the pituitary gland, or it could be due to cortisol which come from the adrenal gland. So if you have excess ACTH, so usually what happens is that we measure the ACTH and along with the cortisol, and if you find that the ACTH is above a particular level, usual cutoff is 5 picogram per ml. So if the ACTH is more than 5 picogram per ml, we make a diagnosis of ACTH dependent Cushing's syndrome. And once the patient has ACTH dependent Cushing's syndrome, the most likely possibility is a Cushing's disease where you have a pituitary tumor. Rarely, out of 100 patients with ACTH dependent Cushing's syndrome, you can have some other tumor elsewhere in the body which is also producing ACTH, which is called ectopic Cushing's syndrome. So this is a very interesting thing how we diagnose Cushing's disease. So once you establish a diagnosis of ACTH dependent Cushing's syndrome, that is, first step will be to diagnose endogenous Cushing's syndrome by demonstrating that the cortisol is high on its own after giving 1 milligram of dexamethasone. Next, you measure the ACTH and cortisol both together, and as a next step, you do a pituitary MRI. A pituitary MRI will conclusively tell us whether there is a tumor in the pituitary. It's very important to stick to the scheme of investigation. Why it's important, I'll tell you. Very often, if someone is overweight or obese, you may be tempted to just directly do an MRI of the pituitary gland. This is fallacious because very often pituitary MRI will show a pituitary tumor. It does not mean that your obesity is due to a Cushing's disease. All right. So you must demonstrate that there is a cortisol is being produced excess in your body, and that cortisol is actually due to ACTH, and the ACTH is actually coming from the tumor in the pituitary gland. All three have to be established in a stepwise fashion. So if you skip one step and go to the third or fourth step, you will not get the correct answer and you may get a false positive, because pituitary tumors are very common. Okay, 1 in 10 people have a pituitary tumor, and those pituitary tumors are harmless lying there. They may not be producing cortisol excess, and your obesity could be due to other causes. So what are some causes which look like Cushing's disease or Cushing's syndrome but are actually not Cushing's syndrome? So even without exogenous steroid, people can have features like central obesity, stretch marks developing, and they could have a problem due to muscle wasting, etc., due to conditions like excess alcohol use, depression, anxiety, usage of various antidepressants, etc. Many of these things actually can cause Cushingoid features or Cushing's-like representation, and this is actually due to excess of cortisol being produced in the body because of chronic stress. So these are actually due to excess cortisol production. These changes occur, but we need to distinguish it from the endogenous Cushing's syndrome, which represents a disease. So for example, if someone is having depression and due to that excess cortisol production in the body, and because of that developing striae, muscle wasting, and central obesity, so this person is not going to benefit by interventions which will benefit patients with endogenous Cushing's syndrome. So we need to differentiate between these two reasons, and this requires a very good endocrinologist who goes as per, who will take a proper clinical history, examine you thoroughly, and make a correct diagnosis in order to reach the best outcome for you. So I hope this video was useful, and we'll have more and more videos about Cushing's in the coming days and months.